Hello friends, Channel 5 in Cincinnati was planning to interview me about use of GLP-1 medications such as Semaglutide and Tirzepatide in women who would not otherwise qualify for this class of medication because they wouldn't have truly obesity or diabetes. But then they decided to change the direction, and because of that, I feel that it's important topic and I wanted to share with you. I'm Nyla Goldenberg from Functional Endocrinology and Functional Aesthetics. I'm a clinical assistant professor for Ohio Heritage University of Medical School and core faculty for Mercy Anderson Internal Medicine Residency. I've been an endocrinologist since 2006 and I have been in independent practice for the last 8 years. So I wanted to share with you that these class of agents, GLP1 and GIP, became available in about 2006 and 5, and originally it was daily or twice daily injection of Byetta, and I was very excited to start using them because of this unique action where people would be able to have reduction of appetite. It was helping with insulin resistance, it was helping with energy consumption, and so on. So as time went on, the medications were progressing in development, and we had once a week injection, which was originally Ozempic for the diabetes. Then the same agent was approved for weight loss, and it was called Wegovy. And then we got GLP-1 and GIP analogs as Mounjaro and Zepbound. And Mounjaro is the same medication as Zepbound, just one is for diabetes, another one is for weight management. However, a couple years ago, there was a shortage of both those agents, or all four of those agents. And because of that, many compounded pharmacies were able to put together and we were able to distribute those agents to our patients. However, we were able to experiment and use it not only for diabetes or obesity, but frequently I would prescribe it for polycystic ovarian syndrome, for those 10 to 15 pounds of pesky weight gain that we get after menopause, or other similar condition. And what I found that the GLP-1 and GIPs frequently were helping not only weight, and frequently they would help with mood. I have one patient who actually had pretty much eating disorder that was controlled really well with this agent without getting her into bulimia and without getting her weight to a super low level. The food noise, as we describe it, was minimized, and because of that, her quality of life was improved. Many patients have shared with me that they had experienced reduction of joint pain and experienced anti-inflammatory properties, in a sense. Their joints were better. And those agents are not prescribed, not FDA approved for any of those concerns. But it was interesting for me to see that. Usually those agents are given for BMI more than 30 if it's obesity, and more than 27 if it's overweight with comorbidities. At this point, some of them are approved not only for diabetes and obesity, but for sleep apnea and for chronic kidney disease and prevention of coronary artery events and stroke events. So we can see how expansive the qualities of those agents. And of course, all of my patients were supposed to do diet and exercise, and most of them tried diet and exercise before, but it was hard to keep up the weight. I was an active coach for Aptavia for several years, and I know that you can lose the weight if you follow the program. It's harder to keep the weight down. Therefore, I wanted to share that those class of agents are wonderful for patients with overweight and obesity, and they would help people potentially to prevent the diabetes too. Again, it's not approved for that, but I'm hoping the more studies are going to be conducted and it will show for sure that that's what's going to happen. I wanted to see if any of you are familiar with people in your life or yourself, if you tried Ozempic or Semaglutide and Mounjaro, which is Tirzepatide, for yourself, or you know any of family or friends who benefited from that, and put it in comments below. And of course, we are all familiar with side effects of those agents. It could be nausea, it could be slowing of gastrointestinal tract, even though some people will develop diarrhea or constipation, but majority of people do not have any of those problems. Up to 10-15% may develop nausea, but usually it's transient and gets better over time. We never give this class of agents for patients with medullary thyroid carcinoma in themselves or in family, and we are not going to give it in history with pancreatitis without any known explanation, and with actual gastroparesis, which is slowing of the stomach. So just wanted to share with you this information and see if you are, if that's a good topic for you, if it was interesting for you to hear about. Have a nice day. Bye.